Hello, welcome to this presentation by FERNE, the Foundation for the Education and Research in Neurological Emergencies. Today we are going to talk about the evaluation of emergency department dizziness patients with new concepts. Today is July 9th, 2020. This is a presentation based on an original podcast provided June 17th, 2020. My name is Edward Sloan. I'm Professor Emeritus at the Department of Emergency Medicine at the University of Illinois at Chicago. I'm an attending physician in emergency medicine at Carle Foundation Hospital in Champaign, Illinois. And I'm Medical Director of the Physician Assistant Studies Program at Dominican University here in River Forest, Illinois. I want to provide a thank you to Sam Ashu, who worked with me on the podcast in June, and Jonathan Edlow, who put together the monograph with EB Medicine regarding this new approach to ED patients with dizziness. At the EB Medicine group, I'd like to specifically thank Erica Scott, Angie Wallace, and Stephanie Williford. EB Medicine did support the development of this educational presentation, and I'm also FERNE President and Board Chair, FERNEorg. FERNE works to improve care of patients with neurological emergencies by improving research and education in providers or for providers for patients with neurological emergencies. I have no other financial conflicts. Other parts of this educational lecture and the complete lecture are available at the FERNE.org website or on our YouTube FERNE.org channel. Also available is the June 2020 podcast, which was presented to participants in 46 countries, as well as a CME option on the EB Medicine website at ebmedicine.net, as well as at the specific website address noted below. Please note the disclaimer listed below. In general, this information is intended to augment and not replace the clinical judgment that guides the management of any individual patient.